I'm from George Mason University, and then I also work independently as a folklorist. And a lot of my interest in death is death and social movements and how we speak about death. So, next up.
And I'm Willow Mullins, and I am also a folklorist. And I also research in death, and my interest in death studies really has to do with death and materiality, and sort of the things and the rituals of death.
Very cool. Thanks so much for coming today. And I'm kind of excited just to talk to you guys because I've been thinking a lot about death since COVID started. So I know it's so weird to say I'm excited to talk about death, but yeah, we've talked about death before. You know, I'm excited in a weird sort of way. But so the big thing there's a lot of things actually, I keep like rolling over in my mind about what's happening right now. But one of the big ones is, what have you seen that's been different about death and how we've approached death since COVID started happening?
Let's see. I've been interviewing some funeral home directors lately, and it's been interesting. Some of them have noticed more of a shift than others. Everybody's noticing something. They put that out there. Numbers are definitely up a little, at least a little bit everywhere. And, you know, we hear the stories that are coming out of New York and places that have had, you know, really been impacted by the pandemic, of funeral homes that are really overwhelmed. But what a lot of them are telling me is that at least, you know, I'm in the Midwest, a lot of them are, it's a much smaller impact, but it's definitely there. And the whole way they interact with the families is very different, partly because everybody's wearing masks, which makes that sort of reaching out and trying to read people much more difficult, and see the family dynamics and how they sort of unfold, and trying to sort of shepherd a family through this moment of having a family member die, has changed a lot of them. And I thought this is really interesting. The sort of rites and rituals are down. So funeral processions are apparently out. People, even like when somebody very wealthy or very sort of, we recently had someone in town that is sort of a big philanthropist in town. And so he has a lot of names on buildings and things like that. They only did a very small funeral procession for him, and it was the first one they've done since March. Wow. And so I guess almost the show of death, for lack of a better way of putting it, seems to be being really toned down.
That's really interesting, because that's kind of the feeling I've been getting in general, is that we're not mourning publicly at all about, I mean, you know, we just hit the 1 million mark worldwide, and, you know, there's no moments of silence, there's no nothing. And it just seems to me so weird, especially after living through 9/11 and things like that there's no big display of mourning. And yeah, so we'll talk about that though more. I swear that was like the first thing I like wanted to dive right into that, but I'm like, no, ask other questions first. So we'll get to that, I promise. But what about you, Kaitlyn? What have you been noticing?
Well, on the other side, what I've been noticing is people do seem to be having like an emotionality about not being able to grieve. And in general, do seem to be very discontent with the state of death and dying as it is. I don't know if you guys have noticed an uptick on the internet about like death-related memes, and they poke fun like in a way that's very uncomfortable about the amount of death occurring. So that's some of the things that I've noticed. Similar to Willow, I've also noticed there's been a downplay in the rituals. So I've had a few people like pass during this as well, not from COVID, but I mean, the Zoom gatherings are happening. And then just like a month or so ago, very small celebration of life gatherings where it's outside, you're with your mask, you're distanced. And it's odd because like you can't interact as you normally would with the families, like, because you're trying to do that social distancing. You can't hug. And even like the language around death that we utilize, like euphemisms, it's just all very stilted because we're all like still in this mindset of being isolated.
Yeah. Yeah, that is so interesting, because it is this weird thing where you know, and I mean, on the times when I have interacted even with friends just generally, like in outside gatherings and places where, you know, it's safe, it's so weird not to hug people. And it's even weirder in that context of death, not to reach, especially to touch people, like to hug them, to put your arm around them, something when they've experienced a loss. And that is so isolating, I think, in so many different ways. That's really interesting. And I don't know how we're going to cope with that. And I think that's a problem, though, generally for a lot of people when dealing with COVID, is the isolation of it. Even if you are, you know, sheltering at home and you do have people around you, there's still a weird sort of isolation there. And it's, of course, even worse for people who are completely alone. Yes, I have also attended a Zoom memorial, and it was, in some ways, it was super cool because we did it in a way that honored the person and what they would have wanted. So, and we were able to do that because it wasn't out in public, right? So we were able to drink his favorite drink, which was bourbon, which we would not have been able to do at a funeral. So that was kind of cool. But you know, it was like it was cool in some ways, like it was great in some ways, and then just weird in others, because of that distance. But yeah, it actually enabled us, I think, probably to talk even more personally than we might have, because it was a smaller group. You know, we were all in our own homes. We were all feeling very comfortable because, you know, we're at home, and these are people we know really well. So there was no notion of I'm crying in public, kind of, you know, that sort of holding back. So that was kind of interesting too, to kind of think of that. And we were able to include people all over the world, which was also nice. So people had moved away, we could still include them in that. So that was also kind of a nice thing to be able to do, which they might not have been able to come otherwise. So it's so strange to have some things be almost, I don't want to say better, but different sorts of mourning than other types, and then other things just being completely unable to do. So it's so interesting to see the creativity that's coming out of this. And I'm sure some of you've probably seen some of this creativity as well. Oh, we have a kitty on.
He likes to make himself known.
Yeah. I'm surprised mine will probably roll through at some point. So that's the best part, though, about these things, is actually seeing each other's pets, I think. So
yeah.
I've been loving meeting everybody's pets. Yeah, I think it is interesting, this sort of idea that we're grieving alone and also together in a way that, like, I feel like normally that's time-based, right? Like, we grieve at the funeral, at the cemetery, we grieve in those first sort of 72 hours after death in a public way, or like with other people. And then, and now it's almost like that's the piece that's being ripped out. Like, that's the piece that we don't have access to right now. And so it's being flipped, I guess. Whereas, like, you know, historically somebody dies. I was thinking of actually when you were talking about my great aunt's funeral, which happened last fall. And so it was before the pandemic. And I was talking with somebody else at the funeral about her daughter, my great aunt's daughter, so my cousin, seemed tired. And the person said, I think that's the point of these things, and is, you know, to sort of occupy the closest relative, or their closest relatives, as much as possible in those sort of first few days. So they do get tired, and then they have sort of that space to mourn individually. Well, now we're starting with the mourning individually while we plan our Zoom memorial, you know, and it's so it's kind of a different, it's being flipped. And you know, there are these great creative responses. I've seen stuff that a lot of people are doing a lot more sort of the home funerals are up. They were already up, but they're even more up as people are trying to sort of make meaning at home and among the family that they're sheltering with. And then at the same time, like we are allowed to, like we have this space to include these people from all over the world, but it's maybe not in the same way that we would have had we not had this sort of isolation in place.
Yeah, absolutely. Yeah, it's so weird. There's no other way to describe it than being just very, very strange to be at home during these times. And I think, I think about things too, like sitting Shiva and those sort of traditions. I wonder how people, if they're adapting them, or, are there like other traditions like the drive-up funeral home that is working a lot better right now than probably would have been in the past? That's.
Well, I don't know.
Sorry.
Oh, sorry.
No, go ahead.
I don't know if you guys saw like a couple different news stories about people holding outdoor funerals at like family drive-in movie theaters.
Wow.
I saw a few different news stories about that happening, just as a way for people to go and mourn.
Yeah,
and a lot of churches are closed or have been closed.
Yeah. And that's a place, I mean, not only for grieving, but also a place where you can find comfort for a lot of people as well, right? There's something about the sameness sometimes, I think, of, the ritual aspects of religion. I was raised Catholic, so everything's always the same no matter where you go. And there is something very comforting about that in times when everything feels like it's falling apart, and going to those places and things are mostly the same pretty much everywhere. So I think we lose that sense of comfort and that consistency as well. When the whole world feels like it's on fire, we've also lost that one consistent thing. So yeah, it's kind of interesting to hear people, how they're being creative about that too, both with the drive-up services, and I've even seen, obviously people are doing church services online, and the same thing with funerals too. This idea of having an online funeral has happened too. And it's fascinating to me to think about, how we're doing this. And I'm wondering too, so I grew up in a culture where we go to the gravesite and bring food and do that kind of stuff. So I wonder if that's up now. Because it is outside and you can go, and like you could be socially distanced in a graveyard and, maybe not right directly by the gravestone. But I'm wondering if there are more people doing those kind of things as well. And I haven't been to cemeteries around here because my people aren't buried around here. So I'm not sure.
I have heard that just like casual visiting at cemeteries is up. Is my understanding that like cemeteries have been sort of pushing. So we have one of the old big park cemeteries from the 1800s. So I'm in St. Louis, and so we have Bellefontaine, which is an amazing place. And they are also now an arboretum. And they have been really promoting, like, come visit Bellefontaine, like you can socially distance here. It's been interesting to see that sort of use of cemeteries as park space coming back as a result of this.
Yeah, that's fascinating because I usually teach a study abroad in London every year. I didn't obviously this year, but one of my favorite things to go is to the a lot of the London cemeteries, because they are used as park space, especially a lot of the older ones, and they're beautiful and amazing, and yeah, they're incredible spaces. And yeah, we don't always do that in the US, I don't think, as much. We don't really treat them as green spaces. We treat them as like this place where you go and maybe you go and put flowers, but you don't spend time there for a lot of people. So I know I grew up in a weird way that we were always, my mom can tell you like the best way to clean a headstone apparently is using Armor All. So any tips on that? My mom is like up on how to clean headstones, and like, because she goes all the time and she goes and takes care of the graves, and for her it's a very comforting thing, but it's just what you do, right? This is how you honor the people that you love that have passed. So yeah, I'm kind of wondering if there is going to be like an upswing and that sort of activity, especially when we don't have it's weird because we have the time to mourn, but we don't have the space to mourn. And And yeah, that isolation has got to be hard on people. But also, I've been hearing a lot about upswings in online therapy. So,
Mhm.
you know,
That's actually the funeral director I've talked to when I asked, like, what is the thing that you think is going to stay? Like, what, like, you know, what changes do you think are going to continue? And most of them are like, I don't know. I don't want to, I don't want to think about it too much. But they all think that the technology is here to stay. They're like, especially because for geographically dispersed families, it wasn't always very easy to get all the family there. And I know in among a lot of African American communities, it's sort of standard to wait a week or two after a death to hold the funeral to give the family time to come in. Well, now because because of Zoom and all these other technologies and Skype funerals and all the rest, they're like, it's making it possible to actually go ahead and have those services, and then have that sort of celebration of life at a time when everybody's more likely to be there, closer to a holiday or something like that. And they do feel like the technology is the part that we're going to get sort of stuck with, if you will, which I think is interesting because in 1918. One of the results of the 1918 pandemic was that it helped funeral homes push for more professional treatment of the body.
Oh.
So it was after that the funeral homes were really able to sort of step it up and say, see, you don't want to care for your dead at home. You want us to do it because we're professionals. So it's interesting. This is going to be a moment where that shifts a little bit. I don't know.
Yeah, that is really interesting. What about you, Kaitlyn? Have you seen, what do you think is going to stick and what isn't?
Well, like Willow was saying, I think the technology is going to stick. The main downside that I've heard from folks is the elderly who have lost people, and that they're not as easily able to use certain technology to attend Zoom things. So it has a tendency to be hitting them even harder because they're not even able to participate in that. And then they're not able to physically attend because they have to be isolated because of pre-existing health conditions. So that's been one problem that I've seen kind of like bubbling up and mentioned by several different people. Yeah.
Yeah, that's definitely a problem.
I do think the impact on the elderly seems to be a source of both a lot of anxiety and also a lot of concern, I think, for a lot of groups. I mean, that people are concerned about how do they even interact with, with people who are in homes that have been closed off. There's a lot of sort of stories of elderly people dying alone, and there seems to be a lot of concern around that and about what it means to die alone. And this being a moment in which we have a lot of people who are, at least reportedly, dying alone, and this sort of being a breakdown in our social order, and the way that we like to take care, the way that we perceive ourselves as preferring to take care of our elderly.
Yeah, and our healthcare professionals, they try to make sure that people aren't dying alone, but they can't always guarantee that because when you go, but it's still very upsetting for the families and the rest of their loved ones when that does happen.
Yeah, absolutely. I mean, that's and I think it's upsetting too, because I know quite a bit of doctors and people that are frontline workers. And it's upsetting for them as well because they're, they like their patients, they want the best for them. And especially my husband works in the critical care unit, and that's a rough place because they can't let people in. It's so hard to have these people who really want other people around, and they, and actually that actually makes it easier sometimes too on the people who work in these hospitals, because they have someone there that's advocating for the patient, that knows what's going on better with the patient and can like alert them to things. So having that other set of eyes is sometimes better for the patient, but also for the people who work in the hospital. So that lack of people in the hospital too, I think is very weird in a lot of different ways. I had a friend who gave birth just right before the pandemic started, and it was like to the point where I was like, should I go to the hospital and see the baby? But they were so lonely because no one was going, so I was like, all right, I'm gonna go. So I went and saw the baby, but they were just like, this is so weird because normally, they even have the rooms set up at our hospitals for visitors, right? So that people come, and then they were saying like, okay, only one person at a time. They didn't really have a lot of rules yet in place, but it was like, okay, one person at a time. We're going to do this. But it's so strange to think of the hospital as this place that is, for lack of better terms, very alive. Like it's constantly got movement. There's all these people everywhere. To have it be so empty in some places and so unfortunately full in others, it's so strange to not have those visitors there, because that is such a big part of the hospital, right? Is places like the gift shop being really busy, and there's a lot there too, that it makes these spaces really, yeah, very different. And it's the same thing I think for those of us who work at universities. Going on campus is such a weird experience right now. If you need to go to your office or something like that, it's such a weird, empty place. And that's, this place that's usually full of life and full of movement, being so empty right now is very strange. So, yeah, that's interesting stuff. So, what else? So, what else do you like? Going back to that idea too of our sort of lack of mourning. Why do you think that is? Like, why are we not publicly mourning?
I think a lot of it has to do with how death is already medicalized in our everyday lives, and how that affects our communications. And then additionally affecting it is how it's very much being politicized by our media outlets. So it's just become like, as soon as like you see that on the TV, you're just like, I don't want to listen to that. Turn it off, because you're already stressed out and like grieving if you've lost people, and it just kind of hurts. Yeah, so we're already very uncomfortable, like as Americans, talking about death in our everyday lives. I go into this rant all the time. I think everybody's heard it.
Do it again. Do it again.
We're here to support that rant.
And a lot of it has to do with, things that affected death previously in our past. So like Willow was talking about how the previous flu epidemic or pandemic like really pushed for the professionalization of death. But in that push for the professionalization of death, it's also removing it from people's everyday lives. So then what happens is like you start losing the pathways that you might have had previously to communicate and perform and move through your rituals in your everyday life regarding like death and mourning and grieving. And really affecting it was the advancement of medicine, because death then turned from not just a thing that happens, it's something that you can potentially beat. It becomes an illness. And then like the language of death kind of becomes centered around these medicalized terms, because that's what the professionals are telling you. And then you become so uncomfortable utilizing those like as a lay person, because like you're not a professional. And we speak about death in euphemisms, which is kind of just talking around death. But I think it's just affected the way we communicate about death permanently. And you are seeing people pushing for us to begin talking about death in our everyday lives, just kind of as we are right now. And I think while we're uncomfortable, and this is not the best of times. I think what is happening, because like you were mentioning earlier, Andrea, was that the Zoom encounter allowed you to speak very like comfortably about that person, and you were able to drink their favorite drink, which you might not have been able to do at a funeral, because like that's not what you do during that ritual. Well, not what you do openly during that ritual, I should say.
As a student, I taught a class on death last spring, which was a weird time to be teaching about death. I had a student who talked about at some relative's funeral, everybody slipped flasks in order to drink a toast. Like part of the. I thought it was really sort of sweet.
It is, especially for that being what that person, honoring that person, right? If there's somebody that liked, to drink, or there's somebody that had a favorite drink, that's, and like, especially with the one that I went to, I was like, yeah, like hanging out with him was having some bourbon and sitting around and chatting, right? Like that was my time with him. So yeah, it does really honor people in that sort of way. And this is, so my husband's from Newfoundland, so they still have like the Irish wake kind of idea there. And I've been to several of these where there is a party. It's drinking, it's hanging out, it's being with the family. And in some places it's still in the home, other places it's at the funeral home, or it's at a church hall or some other sort of more public place. But it's a very different way of mourning, and and it is more about celebration, right, of the individual, and telling funny stories and that kind of stuff, which to me that's more honoring than sitting around and crying, right? Like obviously you miss them and you need to grieve whatever way is appropriate for you, but yeah, I do like that idea too of celebrating the life of an individual, and I do think that at least the funerals that I grew up with were about, trying not to cry and like suppressing all of that and just sitting there and being like stoned through the whole thing, which I was just like, oh my gosh, this is so terrible, right? Yeah. This is just awful. But that's how, kind of like both of you have been saying, is we're so separated from death on that everyday basis. And this is what I find interesting about, especially the death positivity movement, is they are trying to get you more integrated into the process of grieving, and doing. One thing that really I found really interesting, especially, is getting people to wash the body, the family members to wash the body as a sort of last act of service. And I was just like, oh my gosh, that is like, it's like that weird thing as being a North American. I'm like mildly horrified, but also think it's an amazing idea at the same time, right? It's because there is that, we're raised with that idea of like, no, you don't touch dead bodies. That's not a thing. But you do. Right?
I think this is actually part of why I became a folklorist, because I remember hearing like back, I don't know, in the 80s when I was somebody sort of opining about the reason that horror movies were popular in the US was because we don't have any other way of dealing with death. And I remember, like, obviously it's really like lodged in my 10-year-old brain at the time, and it's just stuck with me. But I do think it is really accurate. And especially when you do look at other cultures and the ways that death is handled. When we were at the American Folklore Society conference last year, I was sitting one day with a colleague and friend from Ireland and another colleague from Norway, and we were talking about whether or not kids should go to funerals. Like, should kids see a body?
Oh yeah.
And it was like, for them, being from Ireland and Norway, it was like, yes, absolutely, you could see about, like, this is part of life, is, and they need the chance to say goodbye. And like, they're like, why would you even be asking this question? And another friend came and sat down, who is African American, and she's like, in the African American community, you have to be aware of death early. Like, this is part of being Black in America. And so, yeah, kids go to funerals. And it is this kind of interesting cultural shift that in sort of white middle class America, we're like, nope, no bodies for us.
Isn't that, that's so
Meanwhile,
strange.
In blue collar America, more often than not, the parents can't afford childcare or like have issues finding childcare. So the kids go to the funeral. I went to funerals when I was young. I think my first funeral was 4 or 5. Didn't understand what I was seeing. Understood that everybody was sad. At some point, my younger brother and I were acting up, so my dad had to take us outside to go play. But yeah.
Yeah, it's interesting because I think about my grandfather's funeral. One of my little cousins was there, and I think probably about 4 at the time. And her mother had prepped her for what was going to happen and everything. And she went up to the coffin and just very, very very sweetly was like, "Bye, Bob." and everybody at the funeral was just sort of like, "Oh my God, that's so cute."
Mm-hmm.
But also like she gets it. Like she is saying goodbye. She understands that, there's ways to talk to kids about death that they get it, right? But you're absolutely right too about, different communities have a very different approach to this. And I was thinking about that too. And I was thinking about the answer to, I don't want to say, it was like, we had this problem with death. So then we had death positivity. And then people are like, wait a minute, what about these other communities where death is unavoidable? Like, we're not positive about it because we're being murdered, right? So how do we, and that's kind of where radical death studies kind of came in. Which to me is really fascinating as well, because that's so true that for some people, this isn't about positivity. This is about, this is something that happens. Let's deconstruct that. Let's decolonialize that. Let's talk about it in so many different ways. And I find that really fascinating too, because of course, we're also in this moment during COVID where we're having, protests going on over the murder of people by the police. And, that's such a hard place to be in, especially, I remember when I first started hearing about the protesting, I was like, oh my gosh, there was this little moment where I was just like, oh no, things are so bad. People are protesting during a pandemic. That is how bad things are. And, in my experience where I live in North Carolina, the people who are most likely to wear masks are people of color. So it's so weird to be out in public. And it's I feel like the people who are wearing masks are people of color, little old white ladies, and me, And it's oh God, what is happening here? Why isn't everybody wearing a mask? And that for me is, there's that sort of dual thing where it's here's me as a person, actually a triple thing. It's here's me as a person, here's me as a folklorist, and here's me as just an individual that is concerned about public health and someone that knows a lot about this. So yeah, there's so many things going on for me mentally, but then I'm sitting there thinking oh my gosh, you have these people who are out protesting, putting their lives in danger because this is so important. And of course, we've also found too, because people are wearing masks at protests and because they're being so careful, that we're not having super spreader events at protests. We're having them at things like Sturgis where nobody's wearing a mask. But just that just occurred to me, how bad. I knew things were bad, but I was we're protesting during a pandemic levels of bad. That's a whole next level of bad. And wow, that's, knowing that this is what's happening in these communities is just, it's awful. It's
this we see there's almost sort of this sense of, yes, there's all this sort of pandemic death going on, or COVID related death going on, but there's also all this other death that has been going on all along. And maybe we also need to talk about I wonder if it almost helped open the door as sort of, okay, if we're going to talk about death, we need to talk about all the death.
Yeah. Yeah, absolutely. And, and this is one of those things where it's, I was oh gosh, here I am just being a white lady talking about these things, right? Oh my gosh, I'm so shocked by this. And I'm not, though, because I knew this stuff was happening. I just didn't realize to the extent of which it was happening, right? And it was because we weren't informed about it. We were not being told that these things were happening because we had the privilege of not needing to know. But there are so many places where this is everyday life, right? And you don't have the option to be divorced from death because it's happening so often. And that is, yeah, that's a lot to process. That's a lot to think about. And I'm glad that there are people doing this work, and I'm reading this work and I'm learning. I'm trying to educate myself, but yeah, it's incredible to see this all happening at the same time. And I think that's what is overwhelming to me, is that this, this amount of death and knowing about things like Breonna Taylor would be overwhelming alone, in addition to, but then you have like pandemics on top of it and everything else. It's a lot. It's a lot to deal with. And I think that's in part too some of the reason why we are not acknowledging all of it. And I think in part, as we should be, saying her name and talking about the individuals who have died, I think that it's the sheer amount too that is almost ununderstandable, incomprehensible to us.
Yeah, it's like
numbers.
crushing reality. Like once we start acknowledging that, it's a crushing reality. And we like our death to be veiled. That's what we're used to, and that's what's happening.
Yeah. We like our death to be singular. Like we like to, there's the saying about, like, my grandma used to say, death happens in threes.
Yeah.
But like now we're into death happens in 33,000s.
Yeah.
There is this kind of, so there's a scale issue. There is some, again, like there's this really kind of interesting historic precedence that social movement often happens alongside epidemics. And you think about like the AIDS epidemic, 1918, there was major protests during the 1918 epidemic too, both in East St. Louis and Tulsa in 21 or 20. Sorry, I'm terrible with dates. But it's interesting that that it's almost like there's something about epidemic that frees us as a society to be aware of death on another scale, or to actually maybe start paying attention to death, that maybe when there's not an epidemic going on, feels like, oh, that's that community's concern, like it's their death. But now maybe we have to all talk about it, even when we should have been maybe talking about it all along.
Yeah, absolutely. And I think you're right that we do try to isolate, like you're saying, like the individual death, instead of thinking about it as this collective death. And to me too, it's a collective mourning that we need to have. It's, even if you haven't lost somebody, individually from something like COVID or from something like violence, it's still ours, right? Like it's still, it affects us in a lot of different ways. And yeah, the lack of acknowledgement. I sometimes too wonder if the lack of acknowledgement is because it's still happening, because we're like in the middle of it and we don't have the time or space right now to like acknowledge it, or that we can't deal with that weight right now as well. I'm not sure. Yeah, I'm still kind of wondering about that.
I asked I asked the students in my death class. So like this semester we're talking about death. Halfway through the semester we all have to go home. And so then and I had a couple students who dropped the class. Who were like, I can't handle this and this at the same time, which felt totally reasonable. And at the end we had a conversation about, okay, so what's this moment of mourning going to look like? When are we going to be able to mourn? And I was fascinated that most of them felt like we really aren't going to be able to mourn until it's mostly over. There was a lot of comparisons to AIDS and sort of a desire for almost an AIDS quilt style memorial that acknowledges both the scope, like the hugeness, but also the individual, because there was a lot of concern about the individual getting lost in just sort of this overwhelmingness of numbers, so many people. So I was fascinated that was the comparison that sort of kept getting made. And as sort of things have gone on, and Kaitlyn brought up about sort of the politicization of COVID death, that there's sort of a similar rhetoric happening too, that of this sort of almost search for the perfect COVID victim who only died of COVID. Just like there was the search for the perfect AIDS victim in the early 80s that only died of AIDS. Well, of course you can't only die of AIDS. Like that's not the way AIDS works. And it's not really, it doesn't seem to be, from what I'm hearing, it doesn't seem to be the way that COVID works either. And yet I wonder if there is kind of this, okay, right now we're still in the thick of it. And we almost need that little bit of space to be able to to mourn and to sort of to collectively mourn. But it is also, I'm also fascinated that as Andrea, you pointed out, like there hasn't been sort of a moment of silence for, you know, the 200,000th victim or.
Yeah, just nothing. Yeah.
Yeah, I think the most that we've all seen was when it was the New York Times had posted all the names on the front page.
Yeah.
Yeah.
And that was startling for many, many people. I don't think it's really been brought up much since that happened.
I also,
like, you're seeing people like utilize, they're making their own lists and they're reading out their own names and like the little protests that they've been having like across the country.
Because it's also something that in the protests you're seeing is the naming of names, the say her name movement for this sort of focus on, you know, we have lost individual lives. And I think it's easier for people to relate to that individual, the idea of the individual life, more than it is to understand, well, you know, X number, we just passed the millionth case. Like that's almost incomprehensible.
Yeah.
I also wonder if there's a, you know, being a folklorist and thinking in terms of communities and networks and things like that, there was a fascinating thread on my local community. There's a Facebook group. There's actually two Facebook groups. There's a sort of official sanctioned one, and then there's an unofficial one. So this is on the unofficial one. And somebody posted, does anybody know, like, and they sort of put a caveat on it. They're like, I'm not asking a political question. I just want to know if anybody knows people who have died of COVID. And they got a lot of responses, and it was very clear that it was within sort of family communities. Like some people knew lots of people and some people knew no one, but there was nobody who knew like, oh, I know one or two.
Yeah. That's interesting. Wow. Yeah, that talks a lot about too the contagion of everything too. And then it also highlights all those inequities too, right? Wow. Yeah, it's an overwhelming topic in a lot of different ways. Way to start that like a Tuesday morning on. I also wanted to ask you guys too about the stuff because of course, you know, I'm also a legend scholar and I do like to hear the legends. And I know, Willow, you posted something on social media about meeting someone who didn't think that it was a thing. And we were a funeral home director that said that COVID wasn't a thing. And yeah, what kinds of things like that have you encountered?
I'm hearing a lot of it's not really a thing. Like nobody's really dying of this, and which I think really is that sort of perfect victim, and as well as sort of a management of fear, right? Like, if you can dismiss it, then maybe you don't have to worry about it.
Yeah.
Definitely lots of burial trench and refrigerator truck stuff early on.
Yeah, I remember hearing about those too, especially the refrigerator trucks full of bodies. And it was like this sort of horrifying visual, especially to people who are not used to seeing bodies, of this like literally stacks of bodies. And that sort of horrifying realization. Yeah. I also heard a bunch about, I don't know if you heard about, this is very much a conspiracy theory, but there were this hashtag Film Your Hospital, where people were going into hospitals and showing that there was nobody there. And it was like, and it was so funny though, because like as both a folklorist, but as also a person who's like looking at these things and, my role is obviously not to debunk them. But at the same time, when I see something like that, there's a part of me that's like, do you not know how hospitals work? Like they clear out so that when there's something like a pandemic, they have room, right? So if you're going in a hospital and there's nobody there, first off, they're not going to just let you wander into the ICU. Like that's not a thing. But they were going into like emergency rooms and like videotaping. They're like, look, there's nobody in this emergency room. And it's like, well, yeah, because they're not putting the COVID patients in the same spot as the general emergency room. Like, and like a lot of this is being done outside too. A lot of the triaging was being done outside. So there's a part of me that was like, okay, you're a folklorist, you have to analyze this from a cultural perspective. But another part of me is like, they're just wrong. You know? I'm just being like upset about it. So, and that was one of the ones that I remember just being like, just livid about, being like, you do not understand how hospitals work. You know? But yeah, that was something I saw a lot of.
The AIDS callback legend of people now we're caught. Now it's like not a pinprick. Now it's somebody coughs in somebody's face. Like I'm waiting for somebody. I'm waiting to hear the words "Welcome to the world of COVID." Like,
yes. Right.
Diagram of like the lungs and like explain how wearing the mask is actually causing all these issues with their lungs and actually take it seriously.
Yeah, absolutely. And this is definitely something I mentioned. My husband's in critical care and pulmonology, so he's seen this in his clinics. People are coming in and saying like, I'm worried I'm not getting enough oxygen. And he's like, trust me. And he's actually put people through oxygen tests with and without masks on to show them that, yes, you are getting plenty of oxygen. Like you're okay.
There was a doctor who had done a video of like, here I am with my measuring my oxygen in my blood with my pulse oximeter.
Yeah, exactly.
And a mask doing anything. It's like,
look, it's the same. But yeah, it's interesting. And I get too that there is, especially if you have like an anxiety disorder or other things, that mask can feel very scary and it can feel like your oxygen is being blocked. And there have been times, especially I wear a mask everywhere, even when I'm exercising. So there have been times though when I've been like exercising, like get my heart rate up and I'm like, okay, like this mask feels like it's choking me, and it's not. I know it's not, but there is that perception that my oxygen is being blocked in some way. And that's a very, I think for us that the airflow is such a crucial thing for human beings that like the second it feels restricted, we get panicky, right? So I get that people are feeling that. And I get that, especially if you have something like a panic disorder, or if you're dealing especially with children who might, have different issues, that's really extra hard for them. But yeah, it is.
As a parent, I will tell you, sometimes it's difficult. Mine are old enough that they understand and they are good about wearing their masks. But when it first started, and I was like, and you have to wear this when we go out in public, and they were like, what? Yeah. And it's just sort of, it's unusual. So they were kind of like, and like I said, now it's sort of not a big deal, but like they tug at them a lot.
Yeah, absolutely. And
I remember a girl who looked to be about 4 or 5 years old who had like put hers up over her eyes and was
yeah, I mean, and I get it. It's weird, and it's a different feeling, and and it's like it is hard sometimes to do. But yeah, it's funny too, because one thing I've experienced, I've been bad at twice, like I'm a sheep out in public. So I've actually had people do that to me where they bat at me and call me sheeple and stuff like that. So, which is just, and like, there's like this gut reaction. Again, it's that dualness of being a folklorist, but also being a human being who is like, just so frustrated by this. But yeah, there was one time I actually, when someone was doing that, and he kind of went off on this tangent about how I was living in fear and whatnot. And so I actually said, well, my husband works in the ICU. Would you like me to take this mask off? And he just backed away and walked away from me. And I was like, yeah, that's what I thought. That's what I thought. But yeah, it's so weird to see this playing out. And I think for a lot of us, of when you do this kind of research, especially with legend, it's more fun, and it's more like things that happen to other people. It doesn't happen to you. So I think there is that distance of not only being an academic, but like being an academic looking at something in the past, or looking at something that happened someplace else, and to be like in the middle of it is a totally different experience right now, right? pretty weird. The other thing I was going to ask you about is because, of course, I love the supernatural. Do you think we're going to get different ghosts out of this?
Oh, so ghost stories are way up.
Yeah, way up, right?
Yeah, I agree with that statement.
The ghosts that live in their house because they're home more.
Exactly. Yeah, there's been this huge uptick in people reporting that their houses are haunted because they're home and they're noticing things, right, that they might not have noticed before.
Yeah, we're spending a lot more time alone. Suddenly we start noticing the ghosts. I do wonder if there's going to be, if there will be COVID ghosts in the same, because like I feel like, I mean, I hate to keep talking about 1918, but there was definitely like a whole series of, flu ghosts, right?
Yeah.
From either haunted hospitals or like I think of tuberculosis, like when they were tuberculosis sanatoriums, like there's tuberculosis ghosts. So there's going to be totally going to be COVID ghosts.
Yeah, and I've already seen like an uptick in people like reporting having visitation dreams. So like the dead are coming to visit them in their sleep to communicate with them, and that could be possibly because we're not able to be with our dead as they're dying right now.
Yeah.
So a lot of folks are like, they're coming to me.
Yeah, that I was wondering if that was the first thing I thought of too, is that we're going to have visitation dreams because we can't be with our dead. And
I want to give myself goosebumps, guys.
This is totally circumstantial. This feels like rumor on rumor on rumor, but I'm hearing more sleep paralysis stories.
Mm-hmm. Yeah, no, I've been noticing that as well, that there's been more people reporting sleep paralysis. And and I think because our sleep is so disturbed right now too. I mean, I think that's part of it. We're all really tired. We're all, stressed out. So of course our sleep is disturbed. We're going to have these things. But yeah, absolutely. I'm definitely hearing upticks in all of these things. And it is fascinating to think about. And I do love that idea, though, that we're having these visitation ghosts too, because to me, that's a sense of closure. That's a sense of, there's something really beautiful about those stories. And I love when my students tell me these stories because they're always so personal and so intimate and so beautiful. And it's usually about a grandparent visiting or, somebody else like that, visiting them one last time. Or even just like you hear like stories about smells of cologne or smells of perfume, these little tiny things that remind people. Mm-hmm.
Yeah. Just like when that smell takes over like the entirety of the room.
Yeah. Yeah, those are such beautiful stories. And I heard, I also had someone who was telling me about, they had a thing with butterflies. And a family member that had passed, and that it was, I guess the family member had said, when you see a butterfly, that's me. And just seeing like a lot more butterflies more recently when like, and it's like, and then you sit there and wonder, you're like, is it because we're home more, because we're outside more than we might normally be, right? Or is it the dead coming to visit us and letting us know that everything's going to be okay, and that kind of stuff as well. So yeah, it's such a cool story, and I think it gives people such a beautiful sense of closure, and really helps them process. But yeah, I love those stories. I think they're so beautiful, and hearing about, even like I had one student tell me about one where she felt her grandmother sit on the bed at night, like come in and like tuck her in, and felt the bed go down, and like she would sit like she always did.
Mm-hmm.
Yeah.
I wonder too if some of the visitation dreams are this sort of, we're feeling isolated, we're feeling that lack of community, we don't have the space to mourn as a group.
Mm-hmm.
And so it almost opens this space to, we're thinking about those people that we lost more. And, it makes you feel connected even when you're not feeling terribly connected.
Yeah. Yeah, absolutely. That's a really beautiful idea. I like that. That's probably, oh, sorry, go ahead, Kaitlyn.
Oh, well, I was just thinking like how we connect with people, and, we build these like webs of experience with them, and then suddenly that person's not there, but that connection to them is still there. There's like a void, but there's not. And these visitation dreams are kind of like a way of remaining connected, like reaffirming that connection that you had to them.
Yeah, absolutely. I think that's a beautiful place to end today. Thank you so much for talking to me about this. This was great. This was really, really interesting. And I'm glad to have somebody else to talk about all of my thoughts and ideas on this. I was like trying not to talk too much because I had so much like that I'm processing too. I think that we're all processing. But yeah, I think this is a really good thing for us to talk about.
Well, thank you for putting it together and hosting. I felt the same way. I was like, I have so many and going out of my head.
Yeah, exactly. Yeah, and it's always great to talk to other folklorists about these things because I know we have similar training and we have similar ideas about a lot of different things. So it's always fun to kind of talk to other folklorists about it, especially since we can't go to our annual conference this year, which is so sad. I look forward to that every year.
Our Death Lore gathering last year was just so good.
It was, it was really awesome. I was surprised at how many people showed up. I was just like
surprised. I was like, I'm not here, and it's going to be
folklorist, word of mouth. It makes sense.
It does, yeah.
Do you do deathy things? Well, they're gonna like meet to talk about deathy things. You should go.
Yeah, absolutely. Well, we know what we can propose for like next AFS too is more talking about death and how ritual will have changed and how our whole approach to death will have changed probably by that point. So awesome. Well, thanks so much, everyone. I really appreciate it. I'm going to end our recording and let's see. I'm trying. Yes, stop recording. Excellent. I can do these things.